Hi, good morning, Collins. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 14th of July 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Collins Rosewood.
And what is your candidate number?
My candidate number is 225522255.
Okay. And are you taking this test as a nurse?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Tell me about your professional background and experience in the healthcare field.
I have been a nurse for 5 years. I worked in a hospital and learned from different departments. I specialized in oncology nursing and joined a clinic as a nurse practitioner. I care for patients with cancer and work with other healthcare professionals. I love my job and always try to improve my skills and knowledge.
What strategies do you employ to manage your time effectively?
I manage my time effectively as a nurse by using various strategies. I prioritize tasks based on urgency and importance, and complete the most critical and time-sensitive tasks first. I plan ahead and set smart goals, and monitor my progress throughout the day. I organize and streamline my work environment, and use tools such as checklists, calendars, and reminders to keep track of my tasks and deadlines. These strategies help me to optimize my time and productivity as a nurse.
How do you stay updated with the latest advancements in your field?
I stay updated with the latest advancements in my field by engaging in various learning activities. I read relevant sources of information on nursing practice, research, and education. I attend learning events that offer opportunities to learn from experts and network with peers. I seek feedback and mentorship from senior or experienced nurses who can share their insights, knowledge, and skills with me. These learning activities help me to keep up with the ever-changing field of nursing and enhance my professional competence and confidence.
What steps do you take to ensure effective communication with patients?
I ensure effective communication with patients by introducing myself and explaining my role and purpose, listening actively and empathetically, using simple and clear language, asking open-ended questions, and providing accurate information, using verbal and nonverbal cues, respecting the patient's culture, values, beliefs, preferences, and privacy, and documenting the communication in the patient's record.
How do you ensure patient privacy in your daily practice?
I ensure patient privacy in my daily practice by following the ethical and legal principles of confidentiality and data protection. I only access, use, and disclose patient information for authorized purposes and with the patient's consent. I respect the patient's dignity and autonomy by providing a private space for communication and examination, and by obtaining their permission before involving any other person in their care. I report any breaches or incidents of privacy violations to the appropriate authorities and take corrective actions.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, that's fine.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Good morning, Mihiraa. I'm Nurse Collins, and I'll be assisting you and your little one here today.
Hi, Nurse Collins. Thank you for seeing us.
Mihiraa, I am here to discuss your son's diagnosis, its treatment options, and to clarify your concerns.
All right, nurse.
Your son is diagnosed with an undescended testicle, and I would like to explain it first.
Okay, you may please.
All right. Mihiraa, an undescended testicle occurs when one or both testicles fail to move into the scrotum as they should. It's important to correct this condition because the testicles need to be in the scrotum for proper growth and development. Leaving the testicle undescended can lead to potential problems in the future.
Oh, I see. Could you explain how the correction procedure works?
Certainly. The procedure we recommend is called Orchidopexy. It involves a surgical intervention to bring the undescended testicle down into the scrotum.
Okay.
Before the surgery, your son will undergo a preoperative assessment, which includes some tests and examinations. During the procedure, your son will be under general anesthesia to ensure he is comfortable and doesn't feel any pain. The surgeon will make a small incision in the groin area to access the undescended testicle and secure it in the scrotum. After the surgery, your son will need some time to recover, and the medical team will provide you with post-operative care instructions.
Okay, I got it. But nurse, are there any risks associated with this surgery?
I understand your concerns, Mihiraa. Like any surgical procedure, orchidopexy carries some risks. These may include bleeding, infection, reaction to anesthesia, testicular atrophy, or a recurrence of the undescended testicle. However, it's important to note that these risks are generally rare, and the medical team takes all necessary precautions to minimize them.
That's reassuring. What are the benefits and expected outcomes of the surgery?
I am glad to explain the benefits of orchidopexy, which are significant. By bringing the testicle into the scrotum, it improves the appearance, function, and fertility of the testicle. It also reduces the risk of future complications such as testicular cancer and testicular torsion. The surgery aims to provide your son with the best chance for normal testicular development and overall well-being.
Thank you for explaining that. Is there anything else I should know?
Yes, before the surgery, your son will need to fast from midnight. This is to prevent any problems during anesthesia.
What about his medications then?
Regarding medication, kindly follow the healthcare team's instructions. Some medications may need to be stopped or continued before the surgery.
Okay. How long will the surgery take? I'm worried about the time at the clinic.
Mihiraa, the surgery usually takes 30 minutes to an hour, but you should plan for a few hours for pre- and post-operative care as well.
Yes, I got it. How will my son feel after the surgery? How can I help him at home?
It's a reasonable concern. Well, his pain will be managed with painkillers, and other instructions on how to care for the wound will also be provided in detail. Don't worry about it. Please follow the guidelines to ensure proper healing and avoid complications.
Okay. Will he need more procedures after the surgery?
It's possible, but unlikely. Most cases of orchidopexy are successful. We will check his progress during follow-ups and advise you on any further steps, if needed. Don't worry, we will do our best for your son's health.
Thank you, and good to hear that. Now, I'm feeling more informed.
It's great to hear that you feel more informed, Mihiraa. I'm here to address any further concerns or questions you may have. We also have additional resources and educational materials available if you would like more information about your son's condition or the surgery.
I appreciate that, Nurse Collins. I'll let you know if I have any more questions or concerns.
Of course, please don't hesitate to reach out. We're here to support you and your son every step of the way. If you think of anything later, feel free to give us a call or schedule another appointment. We want to ensure you have all the information you need.
Thank you, Nurse Collins. I feel more confident about the next steps now.
You're welcome, Mihiraa. It's my pleasure to assist you. Take care, and we'll be in touch soon to discuss the next steps of the treatment.
Thank you. That is the end of your OET-speaking roleplay. All the best.
Thank you, Mihiraa.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.